more painful than childbirth. Pain so severe it's called the suicide disease. Pain that hits at the exact same hour every night. Some kinds of pain can't be stopped by normal painkillers. And these are the 5 worst pains medicine has ever documented. Number 5, shingles. Herpes. If you had chickenpox as a kid, that virus never left. It just moved in. The varicella zoster virus goes dormant inside your dorsal root ganglia, basically your nervous system's storage units. And it can stay there for decades, silent, invisible, waiting, until one day your immune system slips, and the virus reactivates. But he raised the weird part. It doesn't spread randomly. It follows a very specific path. A dermatome, one nerve, one strip of skin, usually one side of your body. And the pain? This isn't normal pain. This is neuropathic pain. Burning, electric, hypersensitive. A light breeze? Pain. A cotton shirt? Pain. Even touch that shouldn't register at all becomes painful. That's called allodynia. And sometimes, it doesn't stop. Even after the rash is gone, the pain stays. Months, years. That's postherpetic neuralgia. The virus is gone. Your nervous system didn't get the update. Number 4, acute pancreatitis. Your pancreas is supposed to help you digest food. It produces powerful enzymes. Trypsin lipase amylase. But here is the safety feature. They are inactive. They only turn on once they reach your small intestine. That's the plan. In acute pancreatitis, that plan fails. Completely. The enzymes activate too early, inside the pancreas. Which means, your pancreas starts digesting itself. That's called autodigestion. And it's exactly as bad as it sounds. What follows? Inflammation, swelling, sometimes tissue death, necrosis. The pain, deep, severe, constant, right in the upper abdomen, often drilling straight through to your back. This isn't take a pill and wait it out. This is curled up in the ER, reevaluating your life choices. And no, it's not always alcohol or gallstones. Sometimes your body just misfires and takes you down with it. Number 3, kidney stones. Sounds small, right? Just a tiny rock. How bad could it be? Very. When a stone moves from your kidney into your ureter and gets stuck, it blocks urine flow. Your body responds the only way it knows how. It squeezes hard. The ureter goes into intense peristaltic contractions, trying to force that stone downward. Pressure builds. Fast. Pain signals fire. This is renal colic. And it doesn't stay steady. It comes in waves. 30 to 60 minutes per wave. Over. And over. And over. You can't sit still. You can't lie down. You can't find a position that helps. There is no comfortable position. Pain starts in your flank and radiates toward the groin. And the comparison patients keep making? It's as bad as labor. Sometimes worse. A tiny rock moving through a tube. Never underestimate a tiny rock. Number 2, cluster headaches. If migraines are bad, this is something else entirely. This is one of the most severe headache disorders in neurology. Full stop. The pain is on one side, usually around the eye. Deep, sharp, drilling, like something is being driven through your skull. But what makes it truly terrifying is the timing. Cluster headaches follow a circadian rhythm. They hit at the same time every day, often at night. You fall asleep. You get 1, maybe 2 hours, and then you wake up in pain. Every night, same time. That's why they are called alarm clock headaches. Physiologically, this involves the trigeminal nerve, autonomic dysfunction, and the hypothalamus, your brain's internal clock, which is why they are so precise. And standard painkillers? Ibuprofen? Almost useless. You need oxygen therapy, or triptans. Otherwise, you're just writing it out. And now, number 1, the condition neurologists describe as one of the most severe pains in all of medicine. The one that earned this name, the suicide disease. Number 1, trigeminal neuralgia. The trigeminal nerve, cranial nerve V, controls sensation across your entire face, forehead, cheeks, jaw. Now imagine that nerve malfunctioning. Most commonly, a blood vessel presses against it, near the brainstem, constantly, pulsing, irritating it. And then, it fires. Electric shocks, lightning strikes, explosions of pain across your face. Each episode lasts seconds, sometimes minutes. But the intensity? Extreme. And here is the worst part. The triggers. Not trauma. Not injury. Normal things. Brushing your teeth. Washing your face. Eating. Talking. Even a light breeze. Everyday life. Becomes dangerous. So patients adapt. They stop talking. They stop eating. They avoid people. They become afraid of their own face. That's why it has that nickname. Because for some patients, the pain becomes unbearable. This is neuropathic pain. So standard painkillers don't work. First-line treatment. Anticonvulsants, like carbamazepine. They stabilize the nerve. And if that fails, surgery. Microvascular decompression. A neurosurgeon goes in near the brainstem, finds the blood vessel pressing on the nerve, and separates them. Places a small cushion in between. For many patients, it changes everything. So what does all of this tell us? Pain isn't one thing. It's not just something hurts. It can come from a virus reactivating, an organ digesting itself, a blockage under pressure, a misfiring nerve, or a blood vessel in the wrong place. And sometimes, the worst pain has no visible injury at all, just microscopic processes, deep inside your body, completely invisible from the outside, which is a strange reminder. The human body is incredibly well designed, but when it fails, it doesn't fail quietly. It fails spectacularly. So now I'm curious, which one do you think is the worst? Drop it in the comments, and if you made it this far, you just survived 5 of the most brutal pain mechanisms in medicine. Respect.